Are you familiar with this topic? The ESWL?
No.
All right. When somebody has there's something called, are you familiar with the urolithiasis?
No.
Let's talk about it now. Urolithiasis is stones somewhere in the urinary. Okay. You have different types of urolithiasis. You can have kidney stones, stones in the ureter, stones in the bladder, right? And let me label those real quick. You can have nephrolithiasis. You can have ureterolithiasis, and you can also have cystolithiasis, or even urethrolethiasis. And nephro is stones in the kidneys. Uretero is in the ureters, which connect the kidneys to the bladder. Cysto would be bladder. And the urethro, which is different than uretero. Those two, I just confused them right now myself. This is in the urethra. So this lets you know the locations of the stones, okay? And that's important for you to understand this whole idea, because if you have the patient's abdomen, right, these are the flank areas, meaning the sides. You have your kidneys that are right here. Okay. And then you have the ureters that go down this way. Then you have your bladder. Okay. And then you have your urethra. So depending on where the stones are located, I'm going to draw them in blue and green, okay? If the stones are right here, or the stones are right here, or right here, or right here, they're going to manifest pain in different locations. Does that make sense?
Yes.
That's the important takeaway of urolithiasis. Patients with urolithiasis are going to develop a lot of pain. That's a given. But the thing is that when they have this pain, it depends on where the stones are located. So if you have nephrolithiasis, okay, you're going to have flank pain. Flank is on the sides of below your ribs. You know how when you start running, you have that side pain sometimes? Well, that's similar to what we call flank pain. Okay. You will also have flank pain when you have ureterolithiasis, because there's still, the ureters are also coming down from the kidney area all the way down to the bladder. So you could have pain all throughout there as well. But you could also have it in your abdomen. And then, of course, your cystolithiasis, that could be your suprapubic area. Okay. And then your urethrolithiasis, that, of course, is going to be pain and discomfort in the urethra. So keep in mind that your pain when someone has stones is dependent upon the location. And we call this type of pain that's associated to any type of stones, we call it colicky pain. Okay. Colicky pain.
Okay.
And understand that the stones that we have, if you look at them under a microscope, they're really like the jagged edges. They're very jagged like that. And so if you can imagine that going through the urethra or any type of mucous membrane, as it passes through, it's really doing a number. It's causing some issues right here. So you're going to have some bleeding. So a lot of your signs and symptoms of urolithiasis is going to be hematuria. Is that clear?
Yes.
Okay. There's also going to be spasms, because as the stones are passing through the mucous membrane of any of these structures, whether it's the urethra, the ureters, the bladder, or inside the kidney, it's going to irritate the tissues, and you find muscles underneath the mucous membranes, and that's going to cause spasms. So it's going to cause issues with that's where the pain is associated. Spasms, pain. That's a big issue. And because you're cutting into the mucous membrane, now you're exposing the skin. The skin, what I mean, like not the skin, but the mucous membranes, and you may develop infections now. Does that make sense?
Yes.
And those are the issues associated with your urolithiasis. Now, that's just what it is. Let's go back to the actual question, right? In the sense that it was asking you for extracorporeal shockwave lithotripsy. The word you need to recognize is lithotripsy. Oops, I think I misspelled it. Lithotripsy is where they use sound waves to pulverize or break down stones.
Okay.
When somebody has these stones, even though they're very sharp and jaggedy, we try to get rid of them with the least invasive interventions, meaning we could essentially get a knife and just cut the patient up and start removing these stones, right? We can do that, but now we have to be considering all the post-op complications. So if we can avoid it, we try to do a least invasive procedure. And this lithotripsy is an option. We use sound waves to pulverize or break down the stones, and the patient is able to move them, to passively urinate them. Does that make sense?
Yes.
That's the whole point of this shockwave lithotripsy. Please know that we can do individual surgical procedures to remove any one of these stones, okay? But we're going to be we want to do a lithotripsy because that's going to be least invasive. Remember that after any lithotripsy, you want to strain the urine. You want to strain all the urine because we can catch the sediments of the stone and we can send them to the lab and find out what the stones are made out of. So we can advise the patient, hey, stop consuming Coca-Cola because it has calcium oxalate. Or maybe stop eating so much protein because it contains uric acid. Does that make sense?
Yes.
Okay. So again, you always want to strain the urine. There's a strainer. Got all these little holes in there. And again, it lets the urine pass through, but you keep the actual sediments. Does that make sense?
Yeah.
Okay, good. Any questions about this?
No.